waking up in the middle of the night and struggling to get back to sleep is a problem that plagues millions of adults, especially as they age. While occasional sleeplessness is normal, chronic nighttime wakefulness can lead to fatigue, irritability, and poor concentration during the day. Many people turn to pills, herbal remedies, or endless tossing and turning. But according to Dr. Thomas, one of the most effective methods for drifting back to sleep is surprisingly simple. He calls it an eye trick, a natural way to reset the brain's sleep signals and allow the body to relax again within minutes. Dr. Thomas explains that the eyes are not only for vision, they are directly connected to the brain's sleep-wake cycle. Specialized cells in the retina help regulate circadian rhythm, which controls when we feel awake and when we feel drowsy. When people wake at night and struggle to fall back asleep, it often happens because the brain mistakenly interprets signals that it should be alert rather than resting. By using a controlled technique involving the eyes, it is possible to calm the nervous system and re-trigger the natural mechanisms that induce sleep. The trick is straightforward. When you wake up and cannot fall back asleep, keep your eyes closed and gently roll them upward and slightly back, as though you are looking at your forehead from the inside. Hold this position lightly while breathing slowly and evenly. According to Dr. Thomas, this mimics the natural movement of the eyes during the early stages of sleep, particularly during rapid eye movement, REM. By imitating this process, the brain receives a cue that it is time to shut down wakeful activity and transition back into rest. Many of his patients report that, after practicing the technique for just a few nights, they could return to sleep far more quickly than before. This method works in part because it disrupts the cycle of racing thoughts that often accompanies middle-of-the-night wakefulness. When the mind becomes busy with worries, to-do lists, or random reflections, the body produces stress hormones like cortisol, which prevent sleep. Focusing on a gentle eye movement gives the brain something simple and repetitive to attend to, crowding out anxious thoughts. Combined with slow breathing, it lowers heart rate and signals the parasympathetic nervous system, the body's rest and digest system, to take over. The result is a calmer state more conducive to sleep. Dr. Thomas emphasizes that this eye trick is not a magic button, but rather a tool. It works best when combined with other good sleep habits. For instance, he advises against checking the phone or turning on lights during nighttime awakenings. Even a small amount of light exposure can suppress melatonin, the hormone responsible for drowsiness. Instead, staying in bed with eyes closed and practicing the rolling eye technique maintains the right environment for sleep. If thoughts begin to wander, returning attention to the slow upward movement of the eyes helps refocus the mind on the task of resting. Another reason this approach is so effective, according to Dr. Thomas, is that it does not rely on external aids. Many people become dependent on sleeping pills or supplements, which can create side effects or reduce natural sleep quality. The eye trick, on the other hand, harnesses the body's built-in physiology. Once learned, it can be used anytime, anywhere, without cost or risk. Patients who travel frequently or deal with irregular schedules find it especially useful because it provides a consistent method for reestablishing sleep even in unfamiliar environments. Of course, the technique is not meant to replace medical care for serious sleep disorders. If nighttime waking happens every night for weeks or is accompanied by symptoms like loud snoring, gasping, or severe fatigue, conditions such as sleep apnea, restless legs syndrome, or insomnia may be at play. In those cases, professional evaluation is necessary. Dr. Thomas stresses that while the eye trick is helpful for occasional or mild sleep difficulties, persistent issues deserve medical attention to rule out underlying health problems. Patients who practice the technique often report additional benefits beyond returning to sleep. Many notice that their anxiety lessens as the process doubles as a relaxation exercise. Others find that their overall sleep quality improves because they no longer lie awake worrying about lost rest. The confidence that comes with having a simple, reliable method reduces the frustration that usually makes insomnia worse. Dr. Thomas encourages people to try the eye trick for at least a week before judging its effectiveness. The first few attempts may feel awkward, but with practice, the process becomes natural. Combining it with a few minutes of slow breathing, such as inhaling for 4 counts and exhaling for 6, enhances the calming effect. He reminds patients not to force sleep, but to allow the body to ease into it. Sleep is a passive state, and the goal is to create the right conditions for it to happen naturally. For anyone who wakes at 2 a.m. and feels wide awake, the temptation is often to get up, check the clock, or think about the day ahead. Yet these habits only reinforce wakefulness. Dr. Thomas's advice offers a different approach. Instead of fighting the body, work with it. By using the eye trick, sleepers can nudge their brain back toward its natural rhythm and let rest return on its own. In the end, the solution to nighttime wakefulness does not always come from a prescription or complicated routine. Sometimes, as Dr. Thomas shows, the answer lies in something as simple as the way we move our eyes. For countless people who struggle with restless nights, this small adjustment could mean the difference between hours of frustration and minutes to sweet, restorative sleep.